Virus is steadily dropping in Florida now. There are predictions from the former FDA commissioner that the Delta wave could be the last major wave of infection. This is coming as we start to approach herd immunity. And joining us live this morning, as he often does, is Dr. Edwin Michael from the Center for Global Health Infectious Disease Research at University of South Florida. Always great to see you, Doctor. How are you?
Yeah, I'm very good. And how are you?
Very good,
Amy?
thank you. Listen, this is good news, right? If this is possibly the last major wave, because the Delta wave has really been brutal.
Yes, yeah, absolutely. If we look at the cases and also the model predictions, we've passed the peak, the third week of August. And then after that, there's nowhere else to go for the virus, because the fraction of people who are susceptible and the infected fraction of people, both are shrinking. And we are now reached about 82% of the population may be immune. That is a combination of vaccination, primarily vaccination, but also immunity through natural infections. And that is only about 8% away from herd immunity. And therefore, there's no place for the virus to go. And our models also take into account breakthrough infections. That's not playing that much of a role. And therefore, it is steadily declining, and that is borne out by data as well. If this were to continue, and if immunity, and that is the, that is a slight unknown. If immunity is long-term, this will end. This will fade out third week of December, about December 22nd or so. So very good news.
Yeah, it is very good news. I guess what makes people nervous is that they felt like, gosh, over the summertime, we were through this and things were looking better. And then, of course, this variant emerges. How do we know that another variant won't emerge?
I mean, that is another open question. But there are so many things in our favor. The primary reason that I think we can be slightly optimistic is that previously we still had a large fraction of people who were susceptible. The lockdowns were really great in stopping infections, but it left a lot of people susceptible. So as soon as you lifted the lockdowns, as soon as there was some infection in the community, you get this resurgence. But now that fraction of people who can transmit infection, the fuel for the pandemic is always the fraction of people who are susceptible, who can get exposed to infected people and therefore maintain, transmission. Now that is shrunk. And that means there's also lessened the opportunity for mutants to emerge and spread. So for those reasons, I'm cautiously optimistic that if we maintain the current vaccination rate, and if the child vaccinations were to come, like I said, third week of December, this could occur earlier.
Let's talk about the winter weather. Obviously, here in Florida, we don't experience a big surge in winter weather, but they do up north. How could that impact the virus?
I mean, so far the virus has been transmitted, there's very little information on seasonality. The virus has been transmitting, over the winter as well as, over the summer. I mean, the problem with winter, up north is that people congregate, in closed, indoors. And that's where you give opportunity, for spread to occur. But like I said, if a large proportion of people are immune already, that will reduce the chance for spread to occur, even up north.
Well, we always love when you bring good news our way. Dr. Edwin Michael from the University of South Florida. Let's hope that all of those things hold true. Great to see you, and thank you.
Yeah, thank you so much. Yeah, take care.
You too. Yeah. All right, at 9:17, we're going to check in right now with Chief Meteorologist Jamie King and talk about